We're doing this one for everybody just joining us in person. This is the only person I'm allowed to have contact with is my brother-in-law because we've all been isolated together for like a month now. So
we're a quarantine pod.
Yeah, we're exactly. So the whole point of today's session is that we're going to talk about pain management. So this is Dr. Nadiv Samimi. He's my brother-in-law. He's also one of the most well-known pain management specialists in Los Angeles. And he was an anesthesiologist by training and then went into just pain management, including joint injections and pain medicine and all that kind of
the whole gamut
fun stuff. Yeah. So you're an anesthesiologist. So for people out there who have chronic pain, who should they be treated by? What kind of specialties?
For chronic pain, you want to go to someone who's board certified in pain medicine. But starting, a lot of people start out with acute pain. So we really recommend them seeing their primary care doctor and seeing a physical therapist. I am a huge proponent of physical therapy. Moving is good and moving helps.
Yeah. So acute pain generally can be treated by anybody, you think? Or is it kind of more chronic pain that you guys deal with, or is it anything?
So the pain sort of goes into a couple different categories. The patients that we tend to see are people who have pain coming from the back, and that's something that a pain doctor should see, or even a spine surgeon can start by consulting them. But if it's like a joint issue, then they see an orthopedic surgery. Obviously, if you broke your arm, I can't help you. But if you have a new disc bulge and it's going down your leg or it's going down your arm, or you have this weird pain sensation somewhere in your body, it would require someone more specialized like myself.
And so you guys are actually doing physical treatments with injections and epidurals and things like that. So what kind of, are there doctors you think who are maybe pushing the limit by doing epidurals? Is it better are you much safer going to somebody who's board certified in a certain field of either anesthesia or psychiatry or neurology where they actually do the epidurals more?
Pain medicine, people who get board certified in pain medicine generally come from anesthesiology, which started because we do epidurals for labor and we do epidurals for surgeries. So it naturally evolved as a way that people can go see pain doctors. The anesthesiologists would become pain doctors. But since a lot of people who have chronic pain also have coexisting psychiatric disease, there's psychiatrists who can do interventional pain medicine. There's neurologists who can do interventional pain medicine. And then there's also physiatrists, which even some doctors don't even know what physiatrists are, but they're rehab doctors and they can do pain medicine as well.
Yeah. So the thing I'd be worried about is somebody who's not trained in this stuff doing an epidural on me. Because I used to do epidurals in our training with anesthesia, and we did it for the ER stuff, but it's a little scary sticking a needle into someone's spine and around their spinal cord. So have you seen problems come up from doctors who aren't trained in this doing it?
Oh yeah. Even doctors who are trained. I'm still terrified sometimes when I do these procedures, is you want someone who is appropriately scared of what you're doing. Yes. So it used to be that pain management was a very lucrative field. So a lot of doctors were just taking weekend courses and then claiming to be pain medicine doctors, especially in the realm of personal injury, because you don't need as many certifications. And so, yeah, there's been problems. One of the best things that we do for people is when we burn nerves in their spine to help with neck pain or back pain. Mm-hmm. And a lot of complications were arising, like some people were becoming paralyzed or they were burning the actual spinal cord itself. And that really just happened from people who were just taking weekend courses and claiming to be paying doctors. So, if you're going to see someone, you really want to vet that they're board certified, that they've gone through formal training in pain medicine, not just board certified in their field, which would be like anesthesia or neurology or something like that.
Yeah. So I see a lot of patients that come in and it's always tough for me doing surgery on somebody who has had chronic pain because I'm always worried I'm going to go set something off. The majority, when I see somebody who's on opiates chronically, that's when I really worry because then you're going to operate on them and they've been on opiates all these years. So their receptors for pain are just saturated with medicine all the time. How do you approach those patients? Are they harder to treat when somebody's just been on opiates forever?
It's a great question. So hospitals more and more now are refusing to do any sort of surgery on people who are on chronic opiates unless it's absolutely necessary. If you go into surgery on chronic opiates, it's really hard to recover because you already have a lot more opiate receptors in your body because your body has upregulated them, and you feel pain a lot worse and you're more likely to develop a chronic pain issue. There's some interesting studies that say that people who get surgery, even really painful surgeries without any opiates afterwards, what happens is they have a 95% less chance of developing any sort of chronic pain. So if you go into a surgery and you take a bunch of opiates afterwards, right, and you have to for some, but you have a really high chance of developing a chronic pain syndrome afterwards. And especially if you're already predisposed and have one before and then go have surgery, it's really hard. So what we do is people who have chronic pain and need surgery, we try to titrate them off of their medications, add adjuvant medicines like ketamine. Ketamine's like a big rage now, or even methadone. Even very low doses of methadone can help people taper off their opiates.
So there's ketamine clinics popping up all over LA.
Yeah.
And there are ketamine concierge doctors. Tell me what you've seen in terms of like, is this a real benefit to people having these ketamine clinics for pain? Is it really helping with, depression and pain and anxiety and these things? And have you seen it kind of in some doctors take it too far, doing these like house calls for people who just love ketamine?
Ketamine is a fantastic drug that I think is going to change a lot of pain medicine, or it has already. The people who are on the forefront of pain medicine have been using ketamine a lot more for the last 5 or 6 years. And it's come out into the mainstream because there was a 60 Minutes piece on it, and the New York Times did a piece on it a couple of years ago saying that ketamine was a wonder drug for depression. And it's kind of interesting how that happened. So they started giving ketamine as a pain drug to people in the ICU and people who were actually dying. And they noticed that the patients who got ketamine, their depression and their mood got a lot better. So we've started using that a lot more. There are a lot of ketamine clinics, and I'm actually a proponent of them having these ketamine clinics. I have had patients who have tried suicide on multiple attempts, like jumped off a building 3 or 4 times. And the only thing that has really brought them down to earth is a once a month or several times a month doing a ketamine infusion. It has been like an absolute life changer for people who have really chronic depression. And it's interesting because people who have chronic pain also have depression. And it's like, which came first, right? If I had chronic pain, I'd be pretty depressed too. And ketamine seems to help with both of those issues, which is pretty awesome.
Nice. So the special K.
The special K. It is used as a drug of abuse outside of the US more than in the US. And there are side effects, right? People just think it has no side effects. But you can develop bladder wall pain that is permanent, and you're pretty screwed if you overuse it. So it should be administered responsibly and not bought on the street.
So when these patients come in and get these ketamine treatments, how long does the ketamine last in their body?
It can last just during the infusion. For some people, it can last a month or two. Typically for depression, we'll do 5 infusions over the course of 2 weeks. For people who have like a chronic pain issue, we'll do really high doses for a whole week. Because some of the doctors, and how this was found out too for pain, was that there was this weird pain syndrome called complex regional pain, and nothing treats it. But then one doctor was taking people and putting them in a coma with ketamine for 3-4 days, and it was resolving 50% of the complex regional pain.
And is this anything like electroconvulsive therapy or ayahuasca?
That is another great question. So all of the
great questions.
It seems that it's something to do with hallucinations, right? Ayahuasca. People are doing low dose LSD on a daily basis for mood. Something about triggering some sort of hallucination really helps with depression. The electroconvulsive therapy, I think, is a totally separate matter that I don't know if I know enough to talk about.
Okay. So there's a movie called The Last Shaman. Have you seen that?
I have not.
Okay. So it's a great movie. It's a real documentary that my friend made, Danny A. Or he's part of it. And it's about this guy whose parents were psychiatrists. And so he grew up a little, psyche.
Yeah.
So he ended up with this just chronic depression that like nothing could treat, nothing. And they've tried everything. Yes. Yeah, I know, surprising. But he goes and heads over to Peru and he starts searching for the last great shaman, the last real shaman, because it's all commercialized and everybody goes down to just get like a, crazy trip. And he just really wanted to be treated. So
by like a real person who's doing it.
Yeah, by a real shaman. And he finds this guy who's young, maybe like 40 years old, and he is of this lineage.
40's young.
Shaman, yeah. Yes. Yeah. and so he's in this lineage of shaman and lives in a little village and does some other work as like his actual work, like construction or something, I think. And puts this guy through a rigorous regimen of ayahuasca daily. And the guy is tripping balls and they're like doing all this stuff to him. And he pretty much has to stay in a room for like 1 month. And he comes out and it's you could see it in his face. It's like it comes back, like the normality and everything. So I'm wondering if ketamine and ayahuasca, they have some kind of reset button that they kind of push in our brains. And
we think so. Some of what people tell me too is that while they're tripping, so to speak, or hallucinating, they actually like tripping balls. People go through the weirdest hallucinations. Someone told me that they were on a horse riding through the Sahara Desert. Other people like to go to Africa in their hallucinations for some reason. I don't know why.
It's the homeland.
Or you talk to like dead relatives, which sometimes sounds scary. But they just like something about going into your id and really exploring your mind when it's open with the hallucinogenics is helpful.
Nice. So do you do the ketamine stuff too? Or is that like, are there people who are just really specialized at doing ketamine?
There are people who have opened up clinics where all they do is ketamine. I do it more as a multimodal approach to treating pain and depression. So we don't do a ton, we don't do a high volume of it. I select patients that I really think are going to be helped by it, because I think that there's a lot of people who are being sold that it can solve any problem and any pain problem, but it only really solves select pain problems. And it doesn't help everyone's depression, but it helps a lot of people. But there's people who just want to make a lot of money and just telling people that ketamine is going to solve all their problems.
Yeah. All right. And I know every ketamine doctor I've talked to says that some billionaire or like multimillionaire has called them and just tries to get them to come to their house like once a week just to give them ketamine.
Yes.
And then they say no.
Yes.
That's the only reason they're telling me, is because they said no.
We got a lot of that.
Yeah, I'm sure. So what kind of stuff do you mainly treat?
Before we do that, people do want that, but there's ways around it, right? And the way I do that, for people who are, say, too much pain or agoraphobic and have other issues, you can give people ketamine nasal sprays or ketamine dissolving troches in the mouth. And when done under the supervision, and we can give them some benzodiazepines to really protect them from getting too out of control, there's ways of doing it safely at home.
Okay.
Yeah.
Nice. So the ketamine darts we were giving kids in the ER weren't too dangerous?
No. It's good. It's good for their soul.
It's the best. We used to give kids ketamine in the emergency room because it's a great medicine to give them. It's better than Valium. It really just like calms them down, and it's a dissociative anesthetic, which means that they kind of separate their mind from their body, so they're not really there.
It's true.
It's like PCP. So these kids, they would go from screaming and yelling to like singing for you. So you'd say, you want to get something out of their throat, and you have to go in there and grab it with forceps. I had one patient that was like, no. And we gave her the ketamine, and 2 seconds later, she like starts singing. She says, ah. She goes, want me to say ah? And she starts singing.
Because it cuts off. It's a drug where you can actually do an operation on someone and they're kind of awake and they don't feel any pain.
Yeah, it's amazing. We used to use it for tracheotomies too. So,
ooh, those are scary.
Nah, those are fun. I haven't done them for a while though.
It's so weird. Do you ever, like, when you watch TV and they always have those people who are just like hitting you with a syringe and right away they just like pass out? And that drug does not exist.
Yeah.
There's nothing that you can give someone and like 2 seconds later they're out.
Chloroform.
Yeah, but you'd have to hold it. You'd have to hold it over their mouth. But ketamine is kind of like that. You give it someone like a minute and you shoot it IM and they'll be.
Yeah. Ether would probably be pretty quick too. Everybody would pass out.
Everyone would pass
if you had ether.
Yeah. Type it in.
So are you also in pain management? Are you also a psychiatrist? I find in plastic surgery, to be a good plastic surgeon, you have to have some element of psychiatric evaluation, understanding, and like treatment. And with chronic pain, I think that would be like 1,000-fold.
Oh yeah. A lot of people have psychiatric issues and it manifests as physical issues and it feels just as real. So you really have to approach people that way, right? Chronic abdominal pain, a lot of neck pain all comes from stress. And so part of it is just being empathetic and listening. Yeah. Half of my practice is psychiatry.
Yeah. And people, my patients, I have to do the same thing, and it does affect healing. So you have physical manifestations, meaning if you have anxiety or depression or those kind of things, you actually have a real physical outcome that changes. And I try to explain that to some patients, and some of them wake up to like reality and they're like, oh my God, this has been happening my whole life. You're right. Some of them are offended. Yeah. And they say, how dare you tell me that all of this is because my anxiety, and you're the surgeon, you're supposed to be taking care of things. And I have to sit there explaining them for another half an hour in a calm tone that, no, you idiot, I'm trying to help you.
That's it.
This is part of your healing.
Yeah.
I'm seeing things you don't see.
Yeah.
And it's very difficult because people don't like to talk about the psychiatric aspects of healing or pain. They came to me for plastic surgery. They don't want me to go talking about how they have anxiety and their blood pressure is 180 and they're going to develop a hematoma.
But it's all integrated.
It's all integrated.
You can't treat one without treating the other.
Yeah. So, I'd imagine in chronic pain, you have to do more than I do, and you really have to just sit there and talk to people and figure out, because you're going to treat their pain no matter what it is. It doesn't matter if it's psychiatric, if it's from a nerve ending being bare or torn. You treat it no matter what it is. You just have to figure out what tools you have to get to it.
Right. And I tell people, if you're really depressed or really anxious, nothing I do is going to help until we treat some of that too. Because it's interesting, where pain and where depression are processed are in similar parts or very close in the brain. So when one part is going off, the pain is going to not get better because your depression and your pain or your depression and anxiety are feeding him. And it's this feedback loop too.
Yeah.
And I'm sure after plastic surgery, right, they're going to experience much more pain and probably poor healing if they're perseverating on these things.
Yeah. And I'm lucky to have had like a lot of physical manifestations of like things happen to me. So when they get offended that I told them something, I just tell them, listen, it happened to me too. I was I had stress for whatever reason for this period of time, and I had like a rash on my body, and I had back pain, and I had these things that I would not have had otherwise. And yes, it happened coincidentally at the same time that I did a surgery or I did whatever, but this is what's making it worse.
It's just as real.
Yeah. So it's difficult taking patients, through this kind of stuff and trying to treat everything, but that is what you have to do. What do you do physically on people? Like what kind of treatments do you do? Injections and things like that?
We tend to be pretty conservative. So anyone that comes in, unless it's an emergency, we try to exhaust all non-injection methods, but we specialize in is doing injections. So we'll do injections into the spine, into the neck, the middle back, the low back. We'll do epidurals, which are injections of steroids or other substances around the dura, which is the sac that holds the spinal cord. And an epidural is just cortisone around that or other substances. Or a lot of people just have really bad low back or neck pain, and there's joints. Your spine is made up of all these bones stacked up on top of each other. And where those bones come together, it can be really painful, right? So we inject those joints, and we burn nerves to those joints too, which is probably the best thing that we do for people long term.
Do you actually burn the nerve endings?
Mm-hmm.
So I've seen people do freezing of nerve endings, and I've heard of the burning of nerve endings. And is that a permanent, temporary?
It's temporary, because when you burn nerves outside of the spinal cord or brain, they grow back, right? Nerves in the body grow back. But if you're burning the actual spinal cord itself or brain, those don't grow back. So we're just burning these little tiny nerves that come off a big spinal nerve, but they do grow back. So then that's a procedure that has to be repeated.
And the injections you do like PRP and that kind of stuff?
Yeah, we do PRP. There's other sort of, what's called stem cell injections or regenerative stuff, where we take fat and micronize that. You use that too.
Mm-hmm. Yeah.
PRP we do as well. I like to explain PRP for pain in a way that I think helps people, right? We're PRP, I'm sure everyone or most people know what it is, but we take your blood and we take the plasma and part of it and we spin it. We get the parts of your body that you use to heal yourself, right? If you get injured, you bleed because blood has all of the stuff you need to heal. So if we can concentrate your body's own healing power and then inject it somewhere, it can help that part heal faster just using your body's own power.
So we have PRP, which is platelet-rich plasma. Right. We have nanofat or the mesenchymal stem cells. Right. You also use bone marrow.
We use bone marrow too, yeah.
So bone marrow does have actual stem cells in it, no?
We think so.
And what about people who go get these stem cell treatments that are injected with stem cells? I have my own take on it, and I'll tell you the brief and you tell me. Yeah. I think it's almost all bullshit. Not all of it, but almost all. And the reason is, if they're doing it in the US, it's not really a stem cell. Like right. They're usually using something else and calling it a stem cell, right. Where it's not a real stem cell. A real stem cell, you can have sex and this little sperm goes in this little egg, and then they form this one little thing, and it becomes 2 cells and 3 cells and 4 cells and then 16.
Is that how it happens?
And yeah, this is how it happens. And those cells can turn into anything. These
Yeah.
are stem cells. These are real stem cells. So that's what a stem cell is. People don't really get what it is. That's a real stem cell. It can turn into anything. It can turn into hair, eyeball, nose, boogers, whatever. So not really boogers, but so those are stem cells. When people say they're injecting stem cells, they're usually
total misnomer.
Yeah, they're injecting PRP or whatever. Right. So now let's say you go out of country and then you could actually get injected by some form of stem cells somehow that they took from like cord blood or they took from
Panama is a big one for this.
Panama. Yeah. And it seems to have some anti-inflammatory effect from any of the research studies I've read.
Especially PRP.
Yeah, but PRP too. But it certainly doesn't like heal all. Like you can't just give someone an injection in their blood and then all of a sudden everything in their body cures.
Yeah, there's a lot of snake oil salesmanship. Like people come in and they want IV stem cells thinking that that's going to go and clear up their Parkinson's disease or all these other diseases. Yeah, and I think it's really just a way. The person that's helped most by that is the accountant for the doctor doing it.
Yeah, it's a big business.
There's a big business.
It's a business, and
selling hope to people, especially who are hopeless, it's a big business.
Yeah,
but it can. There's some things that we do that really do help, like PRP, especially for pain. What it seems to help the most with are acute injuries to joints. Like if you have a whiplash injury who's just in a car accident and you inject that into a joint, it works well. It may even work better than steroids because we think of the anti-inflammatory effect. But if you're older and you have arthritis in your joint and you're being told that PRP is going to stave off surgery, it's just not going to happen.
Mm-hmm. So do you try to keep people from doing surgery when you? I mean, do you analyze joint problems just like an orthopedic surgeon would, or do you work with an orthopedic and you guys kind of work together saying, I'll try to do this as long as I can to see, where I can get them and then you operate if I can't, or how does it work?
So people come to me because they don't want to have surgery.
Mm-hmm.
So we'll try to do as much as we can to maximize it. But some people just absolutely need surgery, right? If you have a really bad knee or hip, we can inject the heck out of it, but eventually if you want to keep walking, you're going to have a knee replacement. But yeah, we work in conjunction, like me and orthopedic surgeons and spine surgeons are constantly sending each other patients back and forth. And it's interesting for spine surgery, especially, there's lots of these statistics where, they say like 50% of people don't get better from spine surgery. Those numbers are really different if you do a lot of testing, right? Because the way spine surgery works and what I do is we look at MRI images and we say, okay, this looks wrong. But then when you just treat the images and fix what's wrong on the image, the person doesn't get better. But when you actually send someone to like a pain doctor and you individually numb up different parts of the body and find where that magic spot that works, and then you get surgery there. And this even works for different places. Like, people get hip surgery when they need back surgery and vice versa. And if you individually like numbed up those areas and saw what helped best, then you can plan a surgery that's going to be much more likely to be successful.
So do orthopedic or spine surgeons do that, or do you help in that whole kind of algorithm?
They'll send them to me. If it's a clear cut case so that they, there's a big disc extrusion and there's nothing else wrong in the back, then they're going to operate, right? You don't need me. Yeah. But if you have like multiple levels of your spine that don't look great on MRI, or you have this vague pain in your butt that could be coming from your hip or your back, then yeah, we would inject it and see which responded, and then they can get a surgery that will help there.
Yeah, so that's super interesting because a lot of people going through chronic pain or experiencing it don't understand where it's coming from, and they go and treat the wrong thing. And so you could have a crooked right foot and that could affect your back, your lower back or your ass, and that could be affecting your spine.
Exactly.
And all you would need to do in an early stage for something like that is actually go fix the source of the problem, which is the way that you're walking.
Right.
So that's cool. So in later stages, I guess that becomes very useful too, where it will have already affected kind of that one little thing could have affected multiple.
Right. It's finding that triggering event.
Oh, that's cool. And with the injections, are these like quick things where people go kind of in and out when they're doing the joint injections?
Even the nerve burning, people hear nerve burning, they're like, right? But you come in, we do the procedure, you go home the same day. And even the like epidurals or back injections, like people are very scared of them, but they take 2 to 3 minutes and you can numb people up and you don't even need sedation. Some people need sedation for talking to them. But
yeah. And have you found any so aside from the injections, do you send them home or tell them to take any homeopathics, any supplements, like
Yeah.
things. I found things like turmeric to be anti-inflammatory, and capsaicin and things people use. You can't really use for surgery because it'll just burn.
The capsaicin, yeah.
Yeah, yeah.
Oh.
So, or cayenne pepper, which is kind of similar. What do you guys use?
I really like turmeric.
As a capsule?
As a capsule, yeah.
Mm-hmm.
Curcumin, the active ingredient, you
Yep.
can get that purified. That's a big one that we use as far as alternative medicine goes. I think that the CBD balms and salves seem to help a lot for some people who have like just muscle type pain. It's not going to help if you have like a terrible spine. So the CBD, and actually still just seeing a psychologist to help with some of the pain issues, right? The psych issues. If you have good coping skills, you can get away with not treating a lot of stuff. It's when you don't have a lot of coping skills.
So how does the CBD work? The CBD you're doing topically or as a supplement? Okay. Topically, and you rub it on. Yeah. So yeah, those things are really cool. And
alpha lipoic acid, that's another one we tend to use a lot. Alpha lipoic acid can help a lot with neuropathic pain. The turmeric seems to be more of an anti-inflammatory.
Oh, okay.
Yeah.
Cool. So a question I get, or a comment I get a lot from patients or people in general, they like to get into homeopathic treatments, but their comment is always a little, I'd say, like short-sighted. They always say, well, doctors don't do this because doctors believe only in medicine. And I try to explain that maybe like 100 years ago, yes, but now doctors are we're not stupid people. They're actually, doctors are amongst the most intelligent people. And it's a very difficult school to get into.
Right.
And so you have intelligent people going to a school where they teach you from the beginning to open your mind. I think one of the first examples they gave us as doctors was H. pylori.
Right.
And they say, okay, well, nobody ever thought that H. pylori, a bacteria, could cause gastric ulcers because the acid would be killing the bacteria.
Right.
And then they went and found, no, it's actually the bacteria that's causing it. So that's an example that they gave us. And from that, they do include now in all the pharmaceutical and I'd say, just general medical education using homeopathics. And if you want to, you can go train in that too. So just for people who think that doctors don't use homeopathics, they do. It's just we
just like science to back up the using it.
Yeah, we like proof. And science doesn't and science doesn't mean medicine. Science doesn't mean an actual medication. Science means fact. You have to show me that something works. I'm not just going to use it just because it's natural, because natural things can have problems too. And they do study a lot of these medicines and find out that they do cause problems. And they found combinations of medications with St. John's wort and other things to affect even how you absorb medications, and echinacea on some people who are using it, they found to suppress their immune system. So just be aware of that. The doctors are not stupid. They're usually pretty well aware of these things. And if there's an option to use them, they use them.
You hear people like have vested interest in, in a company, so we're going to use more of those. But, the vast majority of doctors went into it for altruistic reasons. We want to help people. So if it's a homeopathic product versus something that's going to cost them $1,000, I'd much prefer to give them something that was cheap and easy.
Yeah. And they also think that doctors are unaware that big pharma can be evil.
Yeah.
We are the most aware. We know more than anybody about the realities of what goes into that and how research can be skewed and things like that. So
totally.
I'd say the doctors are the ones you can trust the most about what not to use or what to use. Have you seen anything sold back for this stuff that really you think is just taking advantage of people, or banking on popularity of in plastic surgery, you add stem cell to any treatment or cream, everyone's like, oh my god, it's a stem cell, or you put collagen on it and they think it helps your collagen. Do you guys have that too with pain, where you think, oh my god, I can't believe people are buying this?
It's really just the stem cell stuff that's being just inappropriately marketed for stuff it's not going to do.
Mm-hmm.
Right. And people are desperate and they don't want surgery, so they're willing to do anything. And, people hate, especially in Los Angeles, people don't want to have steroids because they think that it's going to make you fat. And it's true, if you had a lot of steroids, it's going to make you fat or lower your bone density. And it's true with repeated injections. But for the vast majority of people, 1 or 2 injections of a steroid is going to be okay. But no, it's mostly the really inappropriate use of these stem cell type products.
Mm-hmm. And a lot of people take these vitamins or amino acids or fatty acids for joints and making their joints more slippery. Does that stuff actually work?
I think that there was studies done on chondroitin showing that it can help with knee osteoarthritis. The rest of it, I don't think that there's great data to support it.
Okay, so taking like tons of vitamins and CoQ10 and...
What do they say about people in LA? We have the most expensive pee in the world.
Do they?
Yeah, because we're just eating all these supplements that are just like bypassing our system and going right out. It's not necessary. The body has evolved over the course of 20 million years to get all the supplements that we need out of the food that we're eating for the most part.
Yeah. I try to explain that to people that we have a very special homeostasis in our body. Yeah, and you don't, if our body goes 1 degree in this direction or 1 degree in that direction, it's a huge change for us. Where all of a sudden you go to someone's at 100 degrees Fahrenheit, they're fine. You go to 102, they're fine. 104, all of a sudden you're tipping the scales and getting organ damage. Your body corrects everything, absorbs everything it needs to absorb. And I always tell patients and friends and my friends' moms who text me about like, why am I taking all these vitamins then? I'm like, I don't know why you're taking all these vitamins.
You're helping the economy.
Yeah, that's what you're doing. You're helping those companies sell more stuff.
Yeah.
People want to do things that are healthy, and that is mainly just eating a healthy, well-rounded diet. Make sure you get all the nutrients, through the diet. You're not going to really help yourself with supplements unless you have a deficiency.
Yeah, no, but eat good food that's good for you, greens, right?
Yeah.
As little like meat and dairy as you can. So forth and so on.
Yeah. So he went vegan-y for a while, right?
Yeah, I was a vegan for 6 months, but man, I love cheese. It's so good.
So you can be largely plant-based.
Yes.
Which is your main reasoning was like heart disease or just trying it, or what was it?
I became a vegan for a couple of reasons. One, I didn't think that we needed to harm animals, and also for health reasons, right? There's all these studies that show that people who are vegan have like 90% lower causes of death from heart disease, from neurologic disease, and even lung disease. So there's something in it that's pro-inflammatory. So that, and then the animals. But I gave up on the milk and eggs. So I'm just a vegetarian.
Okay. All right. Well, my menu is a bit treacherous.
It looks delicious.
It's a bit treacherous.
Yeah.
So, is there anything that you would tell people kind of with chronic back pain specifically? I feel like back pain is
the big one.
Yeah. Is there something you would tell people if they haven't been treated or they've been treated without success? Like what do they do? Who do they go to?
Yeah, there's 2 things I would do if you haven't been treated. One is you start seeing a good physical therapist. Like a good physical therapist can do almost more than a good doctor can do, right? They study for 4 years learning how to do exercises to heal the body. And listen, the body can heal itself for the most part. We've evolved to fix ourselves so we can, keep having babies. So that is good. And then, there's a great book called Healing Back Pain. And then that goes into the psychological aspects of people who have like psychological trauma, and it manifests as back pain. And, I've told a lot of patients that like, I'm just not willing to do anything to you because I think that, there's more going on, and they've read this book and done some of the work, and it has really like helped these people. And if all that stuff doesn't work, then we can do injections and get rid of pain.
Yeah. Yeah. So that's a nice way to, for people to think about it is, yes, you go to the doctor to get diagnosed, but they're not always going to be the one healing you. Sometimes it's you that has to do the work, and that's through physical therapy, which is incredible what it can do for you. Psychology in general, talking to a therapist for some things, especially for chronic pain, I think can help a lot. And do you have like go-to psychologists like in your practice that you just refer people to, or do you work with a bunch?
No, there's a few, but there's quite a few people, especially here in LA, that focus on pain psychology, and they're just great because that's all they do, and they can rewire your brain to sort of ignore some of the pains you have. And I liken it to this, right? If it's raining outside, you can just stay home and not go outside, right? And that's what people with chronic pain do. Or you can adapt because some things we can't fix. So that adaptation, for rain outside is using an umbrella. So you have to go out and do things and just adapt and learn to ignore some of the background.
Yeah. And so that's important to know that you can treat pain both at the source of the pain, whatever is causing it, or
Perception.
you can't fix that, and then you have to fix the actual perception of pain. So we've got some questions we'll go through. Let's see. Oh, well, nothing too interesting. What's the name of that one? All right. So most people want to see Gabby and Vivi, I think. All right, let's see. We got any thoughts on decreasing efficacy over multiple epidurals?
Yes, you're definitely going to get decreased efficacy, but it's also because people just think you're becoming used to the steroids, but actually part of what's going on is your pathology is getting worse, right? And if steroids worked forever, right, and let's use a knee as an example, if you have bad knee osteoarthritis, the steroids work for the first 2 or 3 times, but it's going to stop working and eventually you're going to do something else about it.
All right. So we're going to check out some more questions. This is an interesting one. I heard hyaluronic acid helps with joints. Is that correct?
Yes. We typically use it. It's FDA approved really just for the knee, but we use it off-label on the shoulders and the hips sometimes too. There's a study was a study going on about using it to inject into discs for people who have collapsed discs, and it was so-so.
There's some good comments.
Oh, wow. Ayurvedic medicine? That's great. All the Eastern stuff, cupping, acupuncture, a lot of this is just therapeutic touch, and that's very powerful. When people think that someone is caring for them, they get better. Even if you like your doctor, you get better just by liking the doctor, even without any other changes.
Yeah, and nice doctors get sued less. What is this? So is there hope for patients with severe TMJD? Is that temporal joint?
Yeah.
Temporal mandibular joint arthropathy?
Yeah. Yeah, there's a lot that can be done for people who have gone through all the physical therapy. And I know some great doctors who inject Botox for that. Do you know any?
Yeah, for the jaws?
Yeah.
Everybody does. We do. I do. We do it for the... Oh, me? Yeah. Yeah. So lots of different therapies for the TMJ.
Yeah, people can put in PRP. I think that's been studied. I don't think the stem cells have been studied very much for the temporal mandibular joint, but I don't see why it can't be done. But yeah, there is stuff that can be done.
So how much of the pain is psychosomatic? It could be a lot. It could be, a lot. Lots of other questions. But I'd say if you guys have any questions, contact this guy. If you guys want to find Dr. Samimi, how can they find you? What's your website?
Painandhealing.com.
Painandhealing.com. He's also Pain and Healing on Instagram, Pain and Healing Center. So you can, it'll be up on my page.
Oh.
So this podcast will be up soon on YouTube. So you can see the video as well as the written comments. Okay. So everybody enjoy their Saturday. Is it Saturday? Saturday.
Yeah, it's Saturday.
Yeah. We don't even know anymore. All right. Bye guys.